Linda, we talked about this when the inkling was there about these at-home Pap tests.
Woo! I despise the Pap test. I think I speak for most women out
Everybody.
there.
Safe to say all of us.
You got to do it. But
Yes.
BC is the first in Canada that is going to make an at-home test available. It's really simple to do. You do it at home, and then you mail it in, and you get the results. Yay!
Yay.
I would like to see this mandatory for like the fit test. You should be able to just, go on your computer and get them to send you a fit test, which is, for making sure there's
Precursor
for colon cancer.
Yes,
yeah.
yes. So I
So
like
it's
that
good
we're ahead
news.
of it. I like we're ahead of
Yeah.
it. So we can congratulate our next guest a little bit for getting us ahead of it, as we are joined by our health minister here in BC, Adrian Dix. Thanks for coming in.
Thank
Great
you
to be
for
on the
coming
show.
in.
I'm delighted to be on the show. I finally got invited. I've been waiting.
Woo!
I've been waiting. So
We've
here I am.
wanted you in. Can you tell us, is this at-home test free? And when the results come back, are they simple? You either have an issue or you don't. What if you don't have a doctor? You don't know how to interpret it?
Good question.
So yes, they're free.
Okay.
As they should be. And I think it would make a big difference for when we heard from Bianca Michelle, who was at our press conference, a woman from Prince George, who talked about her experiences, difficult experiences
Terrible.
in doctors' offices, and what a difference this made for her. She was part of the pilot. We did a pilot with 13,000 women involved in it 2 years ago during COVID. So we know we can make it work and
Good.
how it works. And so it's going to start January 29th. You can contact BC Cancer, you look it up on the internet, you get the thing, you can email, there's a phone number as well to contact them, get the test. It's
So
an
you don't even
HPV
have to
test.
go through a GP. So if you
No.
don't have a GP, that's so great.
But the key part is, if the result is negative, meaning there's nothing to follow up on, you're
You're good to
informed
go.
of that.
Yeah. Great.
If it's positive, then you're connected to healthcare.
Oh,
Excellent.
good.
That is
and,
huge.
And so local GP plus with BC Cancer. So both of those things are there.
It's
And
activated.
I think it's really valuable. I think it's going to. We saw in the pilot a real uptake in people doing it, and I think that it's going to mean good news for cervical cancer. We think we can eliminate it in 10 years. With
That would be massive.
and with vaccination, which we're going to talk about.
Let's get to that.
Vaccination for HPV as well, which starts in grade 6. And between those two things, we can get rid of cervical cancer. What an achievement for BC.
My
No
boy is
kidding. That's
vaccinated
great.
against HPV. Let's talk about another sad, sad story of a child dying from the flu.
Yes.
The third.
Yes. Well, in BC, typically in the course of a year, we would lose 3 children linked to the flu. It's linked to the flu. There's a secondary infection, and that's what happened in these cases. And that's happened this year. And Dr. Henry talked about this yesterday, and the people weren't immunized, and it's very difficult to know.
Yeah.
And there's so much grief here that you can imagine.
Can't imagine.
One of the children is under 5. The other 2 are between 6 and 10. There's just so much grief here. So really what it tells us is that the value of getting immunized is
Not too late.
huge for everyone. And to do it now.
Yeah.
Last year, you'll remember, and last year there were 6 children, right, who passed away linked to the flu. Last year we had an earlier peak of the flu, so it was in November into December. We had a huge response in immunization at that time. It was very effective. This year we're seeing a later peak, so we're going to see it January through February. So really encourage people to get vaccinated. It's really important for them to do so for themselves and for their family against the flu and against COVID-19. Those vaccinations are available. We're leading the country in vaccinations, but we're not doing as well as last year. So it's good and bad.
And we're right in the thick of it too right now with the triple-demic, and we're worried about the flu and COVID and RSV and what have you. And that has led to kind of a dramatic number of people who are being hospitalized right now, and very few open beds. You have a whole cascade and not enough doctors. There's a whole bunch of issues that you're dealing with right now that must be very complicated, and people are a little bit concerned when they see these numbers continue to rise.
Well, 10,435 people in hospital. Just to put that in context, it's an all-time record. Now, that's for a number of reasons that people are in hospital, but there is something, first of all, we all can do, which is to get vaccinated ourselves, because that helps us during the season. But as well, the healthcare system is doing more surgeries than ever before. That means that, and even though people have shorter stays after surgeries these days, that's good news. It means wait lists come down, but it means there's a lot of people in hospital. But I'll just tell you this, and this is an interesting fact in BC. In the last 2 years, we have 337,000 more people on MSP.
Right?
337,000 just in 2 years. And this year, it's going to be more than last year. So it's going to be probably, we expect it to be another 200,000 this year. So we're talking about
sustain
500,000 more people. So think of it in terms of family doctors. Right? So a typical family doctor, under our agreement with the doctors, which really helped us in the last year, under our agreement with doctors, family doctor will have about 1,200 patients. So for 337,000, that's 300 net new family doctors to deal with the new people coming to BC. And then, of course, obviously, we have our own aging population and other issues. So these are challenges. And the healthcare system dealt with COVID-19 better than anywhere else in North America, I'd argue, along with people here. So these are real challenges for the system. I think, and I know there's lots of criticism, I think the folks working in the system, our doctors and our nurses and our healthcare workers, they're doing exceptional work.
Yeah.
We're recruiting more people than ever before, but also we're seeing unprecedented demand.
Let's talk about those frontline healthcare workers, the doctors, the nurses, the amazing people, and a lot of them exiting due to stress of what you just explained. The last number of years have been unimaginably difficult for those people. There's a lot of noise, or not noise, sorry, that's the wrong way of putting it. There's a lot of people in that healthcare industry asking for some streamlining of the administrative or the health authorities that don't work the same way. Are you sifting through and fighting through that type of stuff for physicians?
Well, really important one for physicians is in primary care. Yeah. So we have a new payment model. The previous payment model was fee for service. It was piecemeal. You were paid for every little piece of work you did, which was administratively a huge burden. And especially young doctors didn't want to do that. And we have a transformational system. You know, over 60, vast majority of doctors are men. Under 60, vast majority of doctors are women. It's a changing system, and the medical system has to change to that. Younger doctors do not want to run businesses. No. They want to practice medicine. And so we worked with the doctors at BC. We have a new agreement. We've added 600 family doctors, net new this year, 600, practicing longitudinal family practice. Now there's a lot more people and there's all kinds of other circumstances, but that's 600 on a base of about 3,400. That's a big increase, 16% in 1 year. And that's how you do it. You have to work with people to reduce the administrative burden. And the nice thing about the new model, in addition to everything else, is that it's a good deal for doctors. It was a negotiated deal, of course. Right. But as well, it reduced the administrative burden. We got to do more of it. And BC has some of the lowest administrative costs in healthcare in Canada, but we have to continue to do better.
You know, you have been doing so much and scrambling and trying to fix problems and plug holes and get more doctors and accredit foreign healthcare workers and what have you. There's been a lot done. And yet, we just saw this Angus Reid Institute poll, which didn't look good for any of the provinces, so I don't want to single out BC. Yeah. But look at the numbers for BC. From 2020, people were satisfied you were doing a good job, 63%, and then last year, 27%. What do you make of that?
Well, you see the big shift was in 2022, not
with
in
COVID?
2023. What happened was, and we saw this in the polls, and I don't like to talk too much about the polls. I'm still triggered from 2013.
Sorry.
But
there are no dogs here.
I don't want to talk. Don't want too much about. Don't watch too much about polls. You know. You know, what we saw was the big drop in the polls occurred right at the end of COVID. Two things happened. One, we were in collective bargaining with our healthcare workers, and there was some back and forth there, and with doctors and with nurses as well, I would say. And COVID ended. We had a very high rating, and still do. If you took a poll today about COVID, did we handle it well in BC? We still have a high rating.
Yeah.
But in about April 2022, some of the mandates came off, and people moved back to the healthcare system. Now, the healthcare system had just endured COVID. There was a huge coming back to the system, and there were some challenges.
Yeah.
And so what you see in those polls happened actually not this year. It happened more, in the past year, in 2022. You saw where the number dropped was then. And we're about the same number as we were last year. And I think that's legitimate. We have high demands for our healthcare system.
And growing demands when you see we are the elders of Canada, right? Because we have the habitat we do out here, and therefore the population, the boomers aging, that's going to put even more strain on our healthcare system. You know, looking forward, can we see relief coming soon for seniors and for people needing to access the healthcare here in British Columbia?
Well, I think some of the changes we're making are important. It's action, action, action. But that said, we talk about cancer care, which we started talking about. 30,000 diagnoses in the last year. 45,000 diagnoses in 10 years. aging population.
Yeah.
Now remember, this isn't a bad thing. People are surviving with cancer longer. We have amongst the 1 or 2 provinces with the best outcomes in Canada, in spite of all the noise around the system, which is good and positive. But we have to rise to meet that. There's no other option. It's not like, you know, sometimes people say, well, you know, do people need to go or not go to a healthcare facility? If you have cancer, you need care.
You need to go.
You need care. And we want to encourage people to have care. And we don't want people to, we want to make it easier for people. And so while we're building out the system and dealing with this huge population growth, we made the offer for people on radiation therapy to go to Bellingham. And got a lot of
pushback for that.
We got some flack about it. But you know, between 400 and 500 people have gone and got excellent care. And that benefited them and all the other people in the system who were able to get access in BC, because we also increased the amount of radiation therapy in BC. So, you know, I think you can't ask people to wait right now for changes that are coming in the future. You've got to act where you can. There was space available and we acted.
Yeah, especially for cancer. I swear we could keep you here for like
hours,
a half an hour, but we can't because we're out of time. But thank you so much for coming in. You got a tough job.
Hey, it's great to be on the show. Congratulations on the show too.
Come back again.
I'm a regular.
I love that.
Thank you.
I love that.
Appreciate it.
We're on your PBR. Thank you.
You bet.
Adrian Dix.
Right before Blue Bloods.
There you go. Thank you so much.
Great to have the health minister in studio for sure.
All right, still ahead, public protests are on the rise, and 2024 is shaping up to be yet another year where we're going to see thousands of people take to the streets. This is putting a burden on Vancouver police. Chief Adam Palmer is going to join us next.
And it's time for our viewing party. We've got Joan in Victoria. Thank you for cheersing us.
We also have Kathy in Victoria.
Hello there,
Thanks
Kathy.
for watching.
Kelly in Vancouver, you are entered to win a $150 gift card for Lauai.
And Linda in New Westminster, thanks for watching.
You can get in our viewing party. Just email us a photo of you watching us right now, viewingparty@chekmedia.ca.